Hello, my name is Lucinda K, and I'm the author of Hepatitis C Treatment One Step at a Time. I'm a nurse who had hepatitis C, and I've been through treatment 3 times, so I picked up a few tips through my own personal experience, as well as from working with patients since 1998. Today I'm going to give you a tip about how to make the most painless, quick self-injection that you can do. And this is something that I learned from my own experience and was taught because I'm a nurse, but it's not something that I see taught to patients in some of the videos that are given to patients when they have to learn self-injection. So here are my 3 tips. First, review the information that the manufacturer provides about self-injection. If you get that really under your belt, that will help you because that is the best information there is. Second, when you are preparing your site, now I'm just going to show you my arm, but actually do not inject in your arm. The sites of injection are your belly or your thigh. But just pretend for a moment that my arm is, I'm going to use the alcohol swab, and the alcohol will take a few seconds to evaporate. If you were to immediately inject while the alcohol is still wet, that will cause a burning sensation. So we're just going to try to minimize that. So you can wait for that to evaporate. You can speed things up by taking the little pledgelet container that the alcohol comes in and just kind of fan it, help it along. Do not do this because you'll just be blowing germs on your nice clean surface. And then when it's all evaporated, you're ready to inject. The third thing to do, and this is important, is when you inject, you want to make sure that the bevel goes into the skin first. Now, what does that mean? If you had really good eyes or a magnifying glass, you would notice that on a needle, that the needle isn't pointed straight like say a sewing needle. It actually has a bevel in it. And you want the bevel to be up so that the pointed part is against the skin. So when you inject, you're going to inject so that the point goes in first. It's sort of intuitive, but it's very difficult to see the bevel. So what I recommend is that patients either have a piece of paper that's white, because if you hold the needle against the white piece of paper, actually I have a white piece of paper, I'm prepared. If you have the needle against the white piece of paper, don't touch it, just near it, you might be able to see the bevel, or use a magnifying glass. And then when you're ready to inject, make sure that bevel is up, the pointed part will be down, and in your nice clean skin that's got no residue of alcohol in it, just make your injection. These are just small things, but quality of life during treatment means everything. I wish you a safe and quick treatment.